Hello, please subscribe and like for our channel. Thanks very much.
Now, this is the next case, and they say identify the abnormality. Is it clear? Now, this abnormality is just called clubbing. Now, to diagnose clubbing, you need to know that what normally they say an angle that the nail bed does with the nail. Is it clear? There's an angle that the nail bed does with the nail. The nail is what you see, you touch like that on yourself, but the nail bed is where the nail lies. Is it clear? So there's an angle, there's a normal angle that the nail beds make with the nail. Is it clear? And that angle has to be more than 30 degrees. Try to put your finger in front of you. Is it clear? When put your finger in front of you to see your finger. When you see your finger, put your finger straight. Is it clear? In front of you. You try to visualize the angle between the nail and then the edge of the nail. Is it clear? You see that the nail is slightly elevated. Is it clear? From that edge, and that elevation should be at an angle of more than 10 degrees Celsius. 10 degrees, sorry. Is it clear? Now, if that angle is 0 or is less than 0, that's in the negative direction, it's pointing downward, it means that is more of a clubbing. And to diagnose that clubbing, we use the Shamwort test. Is it clear? And that Shamwort test, you just place two index finger in front of you, and then to visualize the window. In order for you to better understand, you buy our book on physical examination, that's schematic physical examination book. If you want to contact us, can contact us on the comments, and I'm going to explain to us, to explain the details to have the books. Now, the next thing is, after identifying that there is clubbing, you have now to know the clinical condition that causes clubbing. Clinical condition that causes clubbing can come from the cardiovascular system, can come from the pulmonary system, can come from it can be even genetic, can come from the gastrointestinal system. Is it clear? So the first thing, cardiovascular system, in the case of a congenital heart disease, you can have clubbing. Is it clear? When you have congenital heart disease, it presents with clubbing. Now, in the case of pulmonary is a major one that presents with clubbing. Is it clear? For pulmonary diseases, you have what? One, you have in the case of cystic fibrosis. When you have cystic fibrosis, present with clubbing. Is it clear? The next one also, we have interstitial lung disease, present with clubbing. You have chronic obstructive pulmonary disease, present with clubbing. Is it clear? Now, genetically, it's going to be, we have familial origin. When you have familial clubbing, so some people have just clubbing like that in their family, so that's familial in origin. Is it clear? Now, other causes of clubbing can be so I've said can be from the liver. Is it clear? In the case of a liver cirrhosis, you can have clubbing. In the case of a biliary cirrhosis, you have clubbing. So those are the different elements that present with clubbing.
Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429. And please don't forget to like and subscribe for our two channels, Science Video Makers and SchrDbb. Let me say the number again: 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.